Alright guys, so let's just briefly talk about the lymphatic system of the thoracic wall. Right, so I'm gonna summarize all the lymphatic system that you need to know that is important um, in the thorax. Right, so remember this is your thorax, and then it's going to have anteriorly the sternum, posteriorly your 12 thoracic vertebrae. So um, lymph from your anterior lateral portion of your thorax drain into your anterior axillary nodes, right? And then lymph in your posterior, we are talking about superficial, right? Superficial lymphatic. Lymph from your um, posterior skin that is above the iliac crest will drain into your posterior axillary lymph nodes. And then lymphs that are associated in the anterior portion of your thorax, like at this region, they are going to drain in the parasternal nodes, or what you call internal thoracic lymph nodes, right? So if we go deep, or deep lymph nodes, right, you're going to have what you call a thoracic duct. So a thoracic duct, it's a duct that will um, that is about 45 centimeters long. It begins as a continuation of the cistina chyli. So in the abdomen, you have what you call a cistina chyli, and the cistina chyli would be anterior to the first two lumbar, which is lumbar 1 and lumbar 2, and then as it ascends, it tapers and continues as the thoracic duct. Take note of this: in the abdomen, the cistina chyli will be between the descending aorta and the azygous vein. The descending aorta to the left, to the right of it will be your azygous vein, and then it's going to be crossed anteriorly by the right cruise of the diaphragm, right? So at the aortic hiatus, which is at the level of Titkoff, we said we use the mnemonic code ATA: azygous vein, thoracic duct, aorta. So you're going to have now your thoracic duct between your azygous vein and your aorta, right? So the thoracic duct is going to ascend in the posterior mediastinum, right, in the right lateral border of your esophagus, anterior to the vertebral column. At the level of the sternal ankle, that is at the lower portion of T4, the thoracic duct is going to change its course and move from the right to the left, and then it will ascend in the superior mediastinum, right, to the left of your esophagus, and then it continues to ascend, and then it enters the root of the neck, and then it moves laterally like this, being anterior to your left phrenic nerve. And then at the junction of the internal jugular vein and the left subclavian vein, it is going to meet with the left jugular lymph nodes and the left uh, subclavian lymph nodes, and then they are going to join and drain into the left brachiocephalic vein, right? Take note of this: the thoracic duct, it drains most of your body, most of your lymphatic tissue in the body. It drains the left of your head, the left of the neck, the left of the thorax, wall of your abdomen, wall of your lower limb. They all drain into the thoracic duct, right? So what are the tributaries of the thoracic duct? We mentioned the left jugular trunk, the left subclavian lymph trunk. We also have the left bronchomediastinal trunk. If you remember very well from our lung tutorial, when we spoke of the lymphatic system of the lungs, we said we have superficial, which is subpleural, and deep. And we said that the deep, we have the pulmonary nodes that will drain in the bronchopulmonary lymph nodes, and the bronchopulmonary lymph nodes will drain in the bronchomediastinal lymph nodes. So the left bronchomediastinal lymph nodes right here is going to drain either directly into the left brachiocephalic vein, or it's going to be a tributary of your thoracic duct. Your thoracic duct is very important because one thing that you have to understand about it is that uh, it is going to be it's going to be sort of like having beads, right, morphologically, due to numerous of valves. So there are numerous of valves that will form beads of the thoracic duct, sort of like a bearded appearance, right? So that's the lymphatic system of the left head, left neck, left thoracic wall, wall of your abdomen, wall of your lower limb. What about the right and the left? The right head, right neck, right upper limb, and the right thoracic wall. So you're going to have what's called the right lymphatic trunk. So the right lymphatic trunk is going to have tributaries of the right internal jugular trunk, right subclavian trunk coming from your upper limb, and then the right bronchomediastinal trunk. They will form what's called the right lymphatic trunk. That is about 0.5 inches, which is 1.3 centimeters, and then it drains into your right brachiocephalic vein. Brachiocephalic vein, right? So that is important. These are the lymphatic system of your thoracic wall. So take note of the course of the thoracic duct and take note of the course of the right lymphatic trunk. So thank you so much. Take care.